Deep venous thrombosis. Clinical signs are absent in 50% of cases. It occurs more frequently in the lower than in the upper extremities. Thrombosis is significant in pelvic and femoral veins, while in infrapopliteal vein thrombosis is usually insignificant. Thrombosis in the upper extremities and right cardiac chambers may result from intravenous catheters, pacemakers, tumors such as right atrial myxoma, endocarditis, and atrial fibrillation. Clinical features of deep venous thrombosis. Deep venous thrombosis in the extremities is suggested by unilateral swelling, warmth, and erythema. There may be pain or tenderness along the course of the affected vein, the so-called positive Homann's sign. Phlegmasia caerulea dolens is cyanosis of the limb due to deoxygenated hemoglobin in stagnant veins. Phlegmasia alba dolens consists of pallor of the limb due to interstitial pressure greater than capillary perfusion. D-dimer is a protein released into the circulation during the process of fibrin blood clot breakdown. Plasmin is an enzyme that produces D-dimer from the cross-linked fibrin. D-dimer assay. D-dimer levels less than 500 micrograms per liter can be used to exclude thrombosis, especially in an outpatient basis. D-dimer is elevated more than 500 micrograms per liter in more than 95% of patients with pulmonary thromboembolism, but is also elevated in other conditions with increased fibrinolytic activity, such as anterior myocardial infarction, sepsis, disseminated intravascular coagulation, postoperative patients, and bleeding. ELISA is the test of choice because of its high negative predictive value, more than 90%. A negative latex agglutination D-dimer assay must be confirmed by ELISA. In order to remember which are the mechanisms for thrombosis, we must remember Virchow's triad. Firstly, hypercoagulability, which is either the result of thrombogenic factors or a decrease in the naturally occurring thrombolytic factors or anticoagulant factors in the blood. Secondly, decreased blood flow, that is stasis. And finally, the damage to the intima. Thrombi undergo complete resolution in about 70% of patients within the first 3 months of an episode of deep vein thrombosis. The post-phlebitic syndrome is seen in about 10% of patients. Other problems include pulmonary thromboembolism, thromboneurosis syndrome, as described by Hirsch and